Let's get right into it. Welcome to The Explainer. Today, we're diving into a fascinating study that honestly really caught my eye. It looks at how technology is literally rewiring modern medicine. We're going to be exploring research from the International Journal of Computations, Information, and Manufacturing, and don't worry, we're keeping it conversational, looking specifically at the intersection of big data analytics, machine learning, and human healthcare.
Okay, think about your last doctor's visit. You know the drill, right? Did you have blood drawn? Get an x-ray? Did your doctor spend half the appointment just typing away on a laptop? Now multiply that by millions of patients every single day. The healthcare industry is generating so much data, it would literally take centuries just to scroll through it all. Which actually leads us to a massive, critical question. Is there such a thing as having too much medical data? I mean, how can human doctors possibly process, analyze, and most importantly, actually use all of this information without missing something vital?
Okay, let's dive into this. Here is our roadmap for today. First, the healthcare data explosion. Then, we'll meet the digital doctors. We'll look at the research, show proof that tech saves lives, check out boosting hospital efficiency, and finally wrap up with the future of smart care. Let's hit it.
Section 1. The healthcare data explosion. Overloaded by information.
You see, the healthcare industry isn't just creating data anymore. We're practically drowning in it. We're talking massive velocity and wild variety here. It's not just the electronic health records logging your prescriptions or dense medical imaging like MRIs. No, it's those wearable devices on our wrists tracking heart rates and sleep patterns 24/7, right? They're streaming this continuous, ever-growing mountain of patient vital signs directly into the ether. It is a full-blown data boom.
But, well, here is where we hit a massive wall. Human analysts simply cannot process this kind of scale and complexity using traditional methods. The core problem our healthcare system is facing right now isn't a lack of information. Actually, scratch that. It's the exact opposite. It is our very human inability to manually sift through this jumbled puzzle of billions of data points to find those specific, life-saving insights hidden inside. We absolutely need help.
Which brings us to Section 2. Meet the digital doctors, the tools transforming care. First up in our digital toolkit is big data analytics. Now think of this less as a giant digital filing cabinet and more like a massive, superpowered pattern recognition machine. Instead of just looking at your individual medical chart, big data analytics lets providers zoom way out. It achieves something literally impossible for our human brains, spotting sweeping disease trends, subtle behavioral shifts, and treatment outcomes across thousands, even millions of people, all at the exact same time.
Then we have machine learning, and man, this is where things get really dynamic. Machine learning doesn't just sit there quietly categorizing data. No, it actively hunts through vast data sets for hidden connections that human analysts would almost certainly miss. And you know what the best part is? It continuously learns and adapts. As new medical research drops and fresh patient data rolls in, these algorithms automatically update themselves. They get sharper, faster, and more accurate at forecasting health outcomes every single day.
And this brilliantly illustrates the relationship between the two. Think of big data analytics as the fuel, the massive amounts of organized, high-quality patient information. Machine learning, on the other hand, is the engine. It's the analytical algorithms that burn that fuel to propel us forward, turning all that historical information into actionable, life-saving predictions. Together, they form what we might call the ultimate data cure.
Section 3. The research, from buzzwords to real-world clinics.
Now, to ground all these abstract tech concepts into hard empirical evidence, researchers ran a highly targeted study. They pushed out an online survey specifically designed for healthcare professionals, clinical staff, and active practitioners. And this wasn't done in some isolated lab. It was conducted across real, public, and private hospitals in the bustling city of Dubai over in the UAE. They collected 142 valid samples from these on-the-ground pros and then analyzed it all using an advanced statistical software called SmartPLS 4.0. Basically, they mapped out exactly how this tech impacts daily care. Moving to Section 4, Proof, translating math into medical impact. Now, what's really interesting about this model is, well, okay, I know it looks like a whole lot of complex math, circles, and numbers, but just follow the flow with me. On the left side, we have our digital doctors, right? Machine learning, or ML, and big data analytics, BDA. Notice how clear direct lines flow from both of these technologies straight over to the right side, pointing directly to PO, which stands for patient outcomes, and HP, healthcare performance. Basically, the math proves a direct, undeniable link. It's working.
Let's simplify that complex statistical web into a really straightforward breakdown. The researchers tested 4 core hypotheses about whether this tech actually improves care. Does machine learning lead to better patient outcomes? Proven. Does it lead to better overall healthcare performance? Proven. Okay, what about big data analytics? Does it improve outcomes and performance? Both proven. Every single major hypothesis they tested about tech improving care was strongly supported by the hard data.
Let me give you a specific number from the study that really hammers this whole thing home. 30%. The researchers found that data-driven approaches account for a massive 30% of the variance in actual patient outcomes. So, what does that actually mean for us? It means that a patient's recovery, their successful treatment, and their overall health outcome are heavily influenced by whether or not these data tools are used. 30% is a huge number when we are talking about human lives. It means these tools aren't just fancy IT upgrades, they are literal life-saving interventions.
Section 5. Boosting hospital efficiency. Optimizing the business of healing.
So the crucial point here is 58%. The study revealed that machine learning accounts for an absolutely incredible 58% of the variation in overall healthcare performance. Just think about that for a second. Over half of what makes a hospital run efficiently, safely, and effectively can be tied back directly to the successful use of machine learning algorithms. It is quite literally the invisible engine driving modern hospital management.
But what do those efficiency upgrades actually look like down on the hospital floor? Well, the study outlines several super practical operational benefits. Hospitals that leverage these tools see significantly lower rates of patient readmissions, which means people get better and they actually stay better. They also experience highly optimized resource allocation, ensuring that nurses, doctors, and critical equipment are exactly where they need to be. This directly leads to heavily reduced overall healthcare costs and a massive decrease in waste. Essentially, hospitals operate fundamentally better and cheaper, and that's a win for absolutely everyone.
Let's move to Section 6, the future of smart care, a new era of personalized medicine.
The practical implications highlighted by these researchers paint a wonderfully optimistic picture of our medical future. Because these systems can spot hidden patterns so well, we are rapidly moving toward an era of true early intervention and disease prevention, literally stopping illnesses before they even have a chance to progress. We're going to see the development of highly personalized treatment plans tailored to your exact biological makeup, ditching that old one-size-fits-all approach. Doctors will be able to predict post-surgery complications before you even get wheeled into the operating room. And on a larger scale, researchers will use these tools to design much more targeted, successful clinical trials, drastically accelerating the discovery of new cures. It's a real game changer.
Which leaves us with something incredibly personal to consider. We've seen the empirical proof, right? We know the math shows these tools reduce waste, boost hospital efficiency by nearly 60%, and directly drive far better patient outcomes. The data cure isn't some distant science fiction. It is here, right now, in the hospitals of today. So think about your own future healthcare experiences for a second. How would you feel knowing a machine learning algorithm quietly and brilliantly assisted your doctor in your very next medical diagnosis? Kind of wild to think about, right? Anyway, I hope you found this explainer as absolutely fascinating as I did. Keep learning, stay curious, and I'll catch you in the next one.